next guest has been selected as one of America's top plastic surgeons by the Consumers Research Council of America, but he specializes in minimally invasive aesthetics and incorporates that philosophy into all of his techniques. Dr. Douglas Steinbrech is with us today to share the latest innovations to help improve facial features that are common areas of concern. Good morning to you, Doctor.
Good morning, Molly. Thanks for having me this morning.
Absolutely. Great to see you. Let's talk about some of the best basic ways to help people improve the overall appearance of their skin and sort of get it ready for this warmer weather.
Right. Well, I'll tell you what. The thing that's going on is when we were in the winter time and we were all hibernating in December and January, we could cover up a lot of things with a scarf, a turtleneck, a coat. But the problem is now it's the middle of the summer and we're going to the beach. We're very exposed, and there's nowhere to hide. You can't cover things up with a scarf in July. So what my patients are most upset about and complain the most about is underneath the skin. Underneath the skin and underneath the chin, this fullness that they have, they don't like it. The double chin, we call it submental fat or submental fullness. And what patients tell me is they think it makes them look older than they feel and it makes them feel heavier than they are. And all the diet and the exercise in this specific area isn't going to improve things. So what we used to do, and me as a plastic surgeon, I used to do liposuction. But the problem with that was it's got incisions, it means downtime, some bruising, some swelling, and patients really didn't like that downtime. And you certainly can't do that in the summer. So now there's a new thing, there's a new treatment, and the great thing about it is it's non-invasive and it's non-surgical, and we can get a similar result to liposuction, but we don't have the downtime. And that's called Kybella. And what Kybella is, we call it, in the medical services, we call it deoxycholic acid. And all that is a fancy doctor term that means it's a natural occurring molecule that's in all of our bodies that helps absorb and helps dissolve dietary fat. But the scientists and the doctors got smarter. We figured out a way to harvest that, put it in a needle, and inject it directly into the fat to dissolve the fat. So it's been an amazing treatment, and it's been really a medical breakthrough to get the similar non-invasive result that we used to get without having the downtime of liposuction.
Okay, so the way it works is that it actually goes sort of below the skin to dissolve the fat. That's how it works, and it's an injection?
Exactly. Exactly. It's an injection, and typically what we do is each injection, you can have it done by your local practitioner. It can be a dermatologist or a plastic surgeon or someone who's been certified to work in a doctor's office, who can inject it. It takes 15 to 20 minutes. You have a little bit of a swelling. You can go right back to work. You can go to the beach for the weekend. There isn't that downtime. And what we do is we do usually 1 to 3 treatments, and we space them out about a month to 6 weeks. So after 1 or 3 treatments, depending on how much fullness or fat you have from the beginning, you can get done with that fat. Those fat cells are gone. They've been eliminated from the body, and that is gone. And we really don't expect any further treatment in the future to be necessary.
And just real quickly again, what areas can be treated?
Right. Right now, the FDA approved it and did specific studies. They did a study on 1,200 people, and they kept it very localized for the area underneath the chin. Maybe someday, it's a great product and it's a great treatment for this area. Maybe someday it will be extended for other areas, but because of the studies were only done in that specific area, that's what we do right now.
And where can people go for more information about this?
People can go to mykybella.com. It is a great website that has a lot of information for 2 things. Number 1, you can get more information about how exactly it works. And then the second thing you can do is you can get the name of a physician in your area that can perform the procedure for you.
Wonderful. Great to talk to you. Thank you for your time, Doctor.
Yeah, thank you, Molly. Thanks for having me this morning. Have a great day.
Absolutely. Same to you.